Hello, Namaste. I welcome you all to the 103rd Easy Ayurveda Gurubodha session. I cordially welcome all of the students to this session. And on behalf of us, all of us students, I cordially welcome Dr. Guraja sir to this session. Good evening and Namaste, sir. I also cordially welcome Dr. Raghuram sir to this session. Good evening and Namaste, sir. So this session is brought to you by easyayurveda.com. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. So coming to the topic of the day, Kanchanara Guggulu. So somebody wanted to know about Kanchanara Guggulu, its uses. So before we dive into all aspects of Kanchanara Guggulu, I request Dr. Guraja sir to introduce this medicine to all of us students.
Thank you, Janardhan. Kanchanara Guggulu is one of the very well celebrated drug of Ayurveda, and it is one of the best combination of drugs, specifically combined with Trikatu, Triphala, Trijata, and Guggulu, Kanchanara, and Varuna. See, fibroids or any something like a tumor, a solid tumor, or something like that. So, which type of condition, many times we come across in many cases. But to be very specifically from point of practice orientation is, it is extensively useful in wherever there is lymph node involvements are there. So we can straight away with this drug, simple main utilization of this drug is in case of Galaganda or Gandamala. Then after that, definitely because its capacity and ability to act on lymph nodes, when the lymph nodes becomes abnormal due to the disease, it behaves like a tumor. So then Kanchanara Guggulu, and this Kanchanara Guggulu is a versatile drug in thyroid-related issues or any nodular growths. It may be even in the uterus, it may be fibroids, it may be breast adenoids, fibroadenoids, so many things. So in these conditions, very extensively can be used, and it has a capacity to penetrate in such a way that because of its Trikatu qualities as well as Trijatas, they have a Tikshna Guna in them, so they carry these drugs to the deepest tissue and help to overcome it. And that's why it is one of the celebrated drugs in case of Galaganda, Gandamala, Apache, Arbuda, or even fibroid, or any cyst formations. So all these things, usually this drug is one of the important and primary yoga which is used.
Thank you, sir. Raghuram sir, your experience with Kanchanara and...
Thank you, Herbert sir. Gurubodha sir has given a brief description of Kanchanara Guggulu, how it acts in these conditions. Especially when there are nodular involvements, definitely Kanchanara Guggulu is the drug of choice. I found that so whenever there are enlargements, especially when it is given with Triphala Kashaya or a self-made Triphala Kashaya, if the patient can make Triphala Kashaya and use Kanchanara Guggulu along with it, or just a Haritaki Kashaya. So decoction of Haritaki, terminal achibula, only with that if it is given. So this was a tip given by some Ayurveda practitioner. So I just wanted to experiment this Kanchanara Guggulu with hot water, with Triphala Kashaya and also Haritaki Kashaya. So with Triphala Kashaya and Haritaki Kashaya, it gave better results than with hot water when it was given with the cystic swelling, tonsillitis maybe. Yes, tonsillitis is another area where we can use Triphala Guggulu. So this, yeah, as Guraja sir said, it is a prized medicine, it is a popular medicine. So depending on the discretion of the physician and also how we read the Samprapti. So whenever there are glandular enlargements, cystic enlargements in those conditions, we can administer Kanchanara Guggulu. This one small tip I wanted to add. So if the others can also experiment with Triphala Kashaya and also Haritaki Kashaya and just note the differences if there are any differences. Am I the only person to note that, or if some practitioners also can do this and note down their observations and discuss with us, point out and bring it to our notice, then it will help in a broad spectrum study. So this is what I have seen. So probably maybe with other kashayas also, with Guggulu Tiktaka Kashaya, Kanchanara Guggulu goes with Kanchanara Guggulu really goes good with the Varanadi Kashayam. So this is another effective combination I have found, Varanadi Kashayam. So many people use Varanadi Kashayam, Varadi Kashayam along with the Kanchanara Guggulu in thyroid cases and thyroid hypothyroidism induced obesity cases. Also, Varanadi Kashayam is given along with Kanchanara Guggulu. So there also it is having very good effect. So overall, it's a broad spectrum medicine depending upon the decision of the physician and the diagnosis and the doshas, and also how the samprapti is broken by the physician. They can use it accordingly with different anupanas, sapanas, and Kanchanara Guggulu will definitely yield very good results. Of course, while speaking about conditions like hypothyroidism, obesity, and all those things, they are those diseases, systemic disorders where simple medicines can be useful, but if they are subjectively brought along with a corrected dietetic pattern and also the lifestyle modulations, and very importantly with the Shodhana courses like a Virechana, Udvartana is very helpful in hypothyroidism and obesity related to hypothyroidism. Udvartana like Snehapana, Udvartana, Swedana, and then followed with Virechana using Varanadi Kashayam and Varadi Kashayam with Kanchanara Guggulu. These things will yield extremely really good results. Overall, in these chronic cases like hypothyroidism and obesity, we need to have a broad spectrum approach depending on which stage of the disease we are handling with, and what complications, whether it is complicated conditions or less complications, it is an acute condition, a chronic condition, depending on so many factors. Our approach and the mix and match of the therapies along with the oral medications will come into the play. So treatment need to be very well planned in these diseases. In diseases like tonsillitis and some other cystic and glandular enlargement, Kanchanara Guggulu itself, given for 1 month, 1.5 months, starts giving very good results. Over to you, Aggravates.
Thank you, Raghuram sir. And quickly going through the shloka of Kanchanara Guggulu. This is from Vaishyaja Ratnavali Galagandadi Roga Chikisa. So it is clearly mentioned in lymphadenitis, hypothyroidism, etc. conditions. So the shloka says, Kanchanarasya grihniyat tvacham pancha phalonmitam nagarasya kanayascha marichasya palam palam patya vibhita datrinam palamardham pratak pratak varunasya akshamekancha patra kaila tvacham punaha tankam tankam samadaya sarvani ekatra churnayet yavachurnam idam tava sarvam tavanevatra gugguluhu sankutya sarvam ekatra pindam krutva vidharayet gutika mahashikaha krutva prabhate bhakshayen naraha. So this is explaining the ingredients of it. Kanchanara, then trikattu, shunti, ginger, black pepper and long pepper, then triphala, haritaki, vibhitaki and amalaki. Varuna is there as well. Then ela, twak and patra are also there. So these are made into a combination, and equal to all these ingredients, Guggulu is taken, and it is pounded well to prepare the Kanchanara Guggulu. In the traditional ingredient indications, it is explained Galagandam Jayatugram Apachim Arbudanicha Granthin Vranani Gulmamscha Kushtanicha Bhagandaram Pradeyas Chanupanartham Kwatho Munditika Bhava Kwatha Kadira Sarasya Kwatha Koshno Bhaya Bhava. It is explained. So the traditional indications of it include Galaganda that we discussed in brief, cervical lymphadenitis and all lymphatic channel conditions. Hypothyroidism can also be included in this. Some people include multinodular goiter also in this under the purview of Galaganda. Then Apache sits on fibroids, Arbuda, various tumors and fibroids again. Another interesting thing here explained is Vrana, ulcers and wounds, Gulma, various skin diseases, Bhagandara are explained. And specifically, 3 different code drinks are explained, or Anupana are explained for this. One is decoction of Mundi or Mundi Kashaya, Sperianthus indicus, or Khadira Kashaya of Acacia Katachu, or Haritaki Kashaya or Abhaya Kashaya is explained. Gurasa to understand its function on on the wound, like it is explained as Vrana is used as an indication, but it contains Trikatu Guggulu itself is like hot. Probably it would help in, say, improving the blood circulation to the local area, thereby improving the chances of wound healing?
Basically, all those Ushna Dravyas, they does the Pachana. So there is an Amapachana because ulcer, if it is there, or it may be an abscess or something like that, or where there is a Paka that needs to be subjected for proper digestion of the unwanted things there. So then the wound becomes somewhat clean, and that wound later starts healing fast. So in order to bring that, that's called Vrana Shodhana purposes. So to remove the slough or anything like that, to in order to digest and throw away these things which are becoming in the way of obstacles for the wound healing. Such type of things needs to be cleansed out. So that purpose will be carried out by the Triphala as well as even the Trikatus and in the Trijata. Particularly Trikatu and Trijata will do that purpose. And definitely these will help to carry the material to the deepest tissues and thereby improve the circulation as well. Then totally the new supplements will come through the blood, definitely helps for the healing of the wound.
Thank you, Gururaja sir. So that's a logical explanation of this. Yeah. So when we see these things, so you can see Vrana, one way of looking at the Palashruti is also the associated disorders. So when we are seeing through the Palashruti, that is the benefits or the chief areas where a particular drug or a herb or a compound is acting, we need to see what conditions have been given as a whole there. We can see Galaganda, Apachi, Arbuda, Granthi, Gulma, Kushta, Bagandhara. So when we see here, we know that in Kushta, Kanchanara Guggulu is also useful. Okay, and Triphala Guggulu is also useful. In Gulma also, likewise, many medicines may be useful. In Bagandhara, again, Triphala Guggulu is also useful. So when we see this condition, there is some, if we can find some logic in clinical practice to see the related conditions which have been mentioned in the Palashruti, here Vrana, ulcers and wounds, Gururaja sir rightly said, Amapachana, when we see all these conditions, predominantly where Kanchanara Guggulu is acting, what we see is a high kapha condition. So when there is high kapha, high ama in the conditions where some secretions, some unwanted liquid products are held inside the body, and as a result of that, there are some pressure wounds and pressure ulcers which are manifested, and the ulcers and wounds which are related to the Granthi, Gulma, Kushta, Baganda, in those conditions where there is kapha predominant conditions, there is oozing. Okay, so there is itching in those wounds and ulcers. In such type of wounds and ulcers, we can selectively choose Kanchanara Guggulu. So, or else when in other conditions like the Kushta, where Kanchanara Guggulu or Panchatikta Guggulu or Triphala Guggulu, different types of Guggulu have been indicated, we can use them selectively. So here, why the question was really valid amongst all, why ulcers and wounds are mentioned here, Vrana. So that probably is an indication that we need to study ulcers and wounds or the Vrana in relation to the other kapha related disorders, ama related disorders where Kanchanara Guggulu has been used. In those conditions, if ulcers and wounds are manifested, we can readily make a choice of Kanchanara Guggulu.
Even in that Galaganda, Apache, Arbuda, Granthi, there will be solid tumors in the initial stages. If it is not treated properly or not medication has been done or initiation has not taken place, then there may be chances that they themselves open up and to form an ulcer. So it's basically previously it is Galaganda, Apache, Arbuda, something like that, which is a solid tumor previously. Now it has become taken a shape of an ulcer. In those conditions also, it can be used.
And coming to the dose of it, the shloka itself explains Putika Mashikaha Krutva Prabhate Bhakshayanarha. So Masha can mean two things. In one meaning, it means 750 mg, and in another context meaning, it means 1 gram. And specifically, it is told Prabhate Bhakshayanarha, meaning it is to be taken in the morning. Question to Gururaja sir first, and then Raghuram sir. This Kanchanara Guggulu and also other Guggulus, how do you look at the dose, and what is the maximum dose you would go for, sir?
See, there is a typical way of Shodhana, then good nature, then whatever the quantity they mentioned, Acharya mentioned, that can be taken a dose for the whole day. It should be whole day. So that's something like that. 1 gram of Guggulu of Kanchanara can be taken in a period of one whole day. So that is a way of understanding. It should be. So it should not be anyway. It should not go beyond 1 gram. If it is if it is done within 1 gram, if it is you are giving in, so that's in such type of cases where it requires to be given for a more number of days, then it is better to stick on to these dosages. Then it will be very easy for us to be in a very at such an area where there is no question of any side effects or untoward incidents. If it is to be given more than that, then it should be done under the supervision of the doctor and for a shorter duration. Later, it is better to be reduced to 1 gram per day dosages. That will be very useful from the point of practice.
Thank you, sir. Raghuram, sir, please.
I'm in total obedience with Gurubodha sir. So that is the right way of prescribing dose. I don't differ in this. So this is the right way. So to do. If extra dose need to be given, some companies also have a Guggulu DS, like double strength. I'm not sure what do they mean by double strength, and how, whether it is fortified or what exactly it is there. Whether it is double the dose of the Kanchanara Guggulu or the Kaishara Guggulu, Yogaraja Guggulu, whatever it is there. And there is also a practice in North. I'm not pointing towards North or South or whatever in India. North India, where loading dose of Guggulus are given. So we know certain practitioners who give 4 tablets thrice a day, 4 tablets 6 times a day. So like loading dosage. So in some Santarpanavta Vikaras and some conditions. So that I think is too harsh to give in a larger dosage. As Gururaja sir rightly pointed out, the tolerance of every medicine will be limited to its own limitations, and the classical reference is the standard reference for us. We will stick on to those reference. If large dose need to be given in some conditions, definitely it needs to be done under the supervision of the doctor. The doctor should be taking the decision and not the patient.
Thank you, sir.
Yeah.
And there is an interesting observation out of experience of this one. So the question is, sometimes I use Kanchanara Guggulu to help with subclinical hypothyroid condition. It has a beneficial effect on thyroid condition, but notice this leads to toes being very hard, very sensitive toes. Like even a little touch would be very painful, looking like blood accumulation or Rakta Pitta. Does Vata Pitta condition have an effect on it? Guru sir, please, how do you assess this?
So very typically, in my practice, I have observed this Kanchanara Guggulu and used in many patients, but I didn't notice none of my patients have complained about this type of sensitivity. But there is a possibility of Pitta Prakriti person, and if Guggulu is not properly subjected for Shodhana, this type of side effects or untoward effects, so that needs to be taken care of. And definitely the company which is being used are taken, for the purpose here, the one who has asked the question, and that needs to be taken care of, whether they are following that proper method of Shodhana or not. So that is one important thing. The purification of a Guggulu, subjecting before formation of the manufacturing of the Kanchanara Guggulu, that needs to be taken care. It should be from a very high and good quality resinous things, and it should be subjected for Triphala Kashaya and such other Kashayas as prescribed in the classical text, subjected for Shodhana. Then if it is required, where we are using, we may even use certain drugs which are helpful in those conditions. Even with those rasas, the bhavana can be given, one Shodhana can be given. So it's like that if you prepare, usually it won't come across any of the problems of these side effects or something like that. But taken care is that the patient should not be a Pitta dominant person. If it is a Pitta dominant person, then reduce the dose, then such type of things will not occur.
This overall looks like a typical case. So generally we don't find such untoward reactions, as Gururaja sir rightly pointed out. But it looks like a superseded condition of a Vata Rakta here in this particular condition. Better to switch over from Kanchanara Guggulu to Kaishara Guggulu at this particular point of time and observe if there are changes. Definitely, I think these symptoms can be handled if there is a switch over from Kanchanara Guggulu to Kaishara Guggulu at this particular point. So because it looks like a superseded Vata Rakta type of condition in a subclinical hypothyroid condition. So that there may be a chance. Kanchanara Guggulu should be an option here.
That's a brilliant suggestion, sir, because Kanchanara Guggulu is useful in vascular disorders associated with inflammation.
For some days until there is a substantial relief, even Kokilaksham Kashayam can be continuously used along with the Kanchanara Guggulu. I think later only Kanchanara Guggulu can be kept for a few days. And the observation, it should be observed how the symptoms are responding to that.
Yes, and does this patient has any other condition that needs to be considered? Yeah, usually in Pitta Prakriti persons, this could be a problem. And coming to its usage in pregnancy, can it be used for at least, for Guru Raja sir, can it be used for at least a few weeks, or you would not recommend it at all?
Generally, any Guggulu preparation is not recommended in case of pregnancy. However, if it is required in a small dose, which can be used in case of any hypothyroidism associated in that pregnancy related issues. But we need to be careful and it should be observant, and we should be repeatedly every quarter we need to go for an ultrasonography to assess the growth of the fetus. If it is going in a normal way and the predicted weight of the fetus is almost equal to the gestation period, then there is no issues. If it is any problem is noticed, slightest things, or maybe the growth is not up to the mark, then avoid it. All Guggulus need to be avoided during this period, particularly in pregnancy. Because the Purana Guggulu, what we use, it is having a capacity to act as a karshana, or it is a chelating material, whereas in case of a fetus, it is a growing one and it should not be subjected for chelation. So that's the reason Acharya has also mentioned not to use us. So as far as possible, avoid it. There is no other way, need to give it, then give it in a small doses, then observe these changes carefully. Any slightest variation, if you observe in case of ultrasonography findings, stop these medicines.
Thank you, sir. And I have seen the usage of Kanchanara Guggulu by some doctors in respiratory conditions. The theory is that it contains Trikatu, Triphala, and Twakpatra and Ela. So all these are used commonly in respiratory disorders. And because it has that cyst breaking effect, if used with suitable code rings like Kanakasava or Dashamula, Katutraya, Kashayam, etc., it can help break the phlegm deposit so that the breathing improves, and also a little bit of anti-inflammatory effect and Kaphavata Hara effect can be seen. And has seen some doctors considering it has Varuna, Kratayavai Nurvala, although the dose, a proportion of it is very minimal compared to the other ingredients. It has some the water drainage or / diuretic effect, which again helps in improving the breathing. Raghuram sir, please, your comments on this.
Agree, sir. So when we see the Srota Dushti Lakshanas, Sira Granthi is one type of Srota Dushti Lakshana. So there are majorly four different forms of Srota Dushti, that is contamination or obstructions of the transporting system in the body, the channels, what we can call it as Srotas. Among them, Sira Granthi is one among them. Sira Granthi can be considered as cystic, nodular, any type of. So starting right from a small cyst to a big tumor, everything will be considered as a Sira Granthi. So probably with or without cumulative changes, so or having some secretions or whatever. When we look at the respiratory disorders, as you were telling, in conditions like a bronchitis, a chronic bronchitis, an asthmatic bronchitis, probably where there is a phlegm consolidation in the respiratory passages and it is very stubborn, and it itself appears like a granthi. So the consolidated sputum or the phlegm, which is very, very stubborn and which is not coming out, itself looks like a Sira Granthi. So that may be a logic of administering Kanchanara Guggulu. I personally have not administered Kanchanara Guggulu in respiratory conditions, but I think it is a wise choice to make it, along with the disease modifying kashayas like Elakanadi Kashayam and Dasambula Kadutraya, as you rightly mentioned. With those kashayams and some medicines which are used for the respiratory conditions, and Patya, if we can use Kanchanara Guggulu. So I think that can be a game changer in respiratory conditions.
And because like we have published an article and many people ask different questions. So these are all are the indications from various practitioners with Kanchanara Guggulu. These were indicated. Sorry, prescribed by other Ayurvedic doctors. I'm just putting it here for the this one. Partially useful in some people use it in fallopian tube obstruction. Similar theory probably as respiratory obstruction or Siragranthi. In a tubercular cyst with limited use, uterine tumor, fibroid, subserous fibroid, node in vas difference, polycystic ovarian disease, ovarian cyst. Again, water retention is a problem, and again, there are cysts in the ovary. Again, probably there it is useful. Endometriosis. I mean, this is not like I have used this. This is just various doctors' opinions that I'm collecting here. Lipoma, non-cancerous breast lump, liver cyst, myositis, blocked fallopian tube, again, prolactinoma, gynecomastia. Guru says probably it is safe to say that it can be like partially useful in these, even in like cancer, like I keep on getting questions like, can it cure cancer or tumor, etc. At the best, it can be said as partially useful, but may not be a cure.
In my practice, I have observed that I use a combination of drugs in particularly the cancer patients after surgical intervention. Many times I do get a chance of diagnosing the patient of cancer for the first time in my clinic. So whenever we got an opportunity, we suggest them to go for the surgical intervention first. Then the chemotherapy, radiotherapy, if it is not required, you can stop it. And in that position, we can go for Ayurveda treatment. So I usually go for the PET scan and I'll observe that whether there is any local spread or it may be distant metastasis. Based on that, I'll select the drug. Usually when there is a local spread of lymph nodes, maybe one or two, then maybe even to the 10, 15, but it is in locally, the disease is locally restricted, then there is no distant metastasis. In that condition, preferably I go with Kanchanara Guggulu and Gandamala Kandanarasa. There is a typical drug which can be made as a combination. But before this, what the discussions went on that using Kanchanara Guggulu in respiratory conditions, I don't find it as much useful because when there is a respiratory issues are there, we have got still better and strong drugs like Shvasakas Chintamani is there, Vyoshadi Vataka is there, even Shvasakuta Rasa is there. There are plenty of drugs which can be even more penetrative in nature and can produce the good results. So its only thing is that when we don't have any of those type of drugs, then only if Kanchanara Guggulu is there, then because of its ingredients and its nature, which can be used in the conditions. It's a limited usage. I cannot say it is clearly it is going to be a game changer in respiratory system related diseases. If it is respiratory system diseases, then we have got better drugs to go with that. And in case of cancers, definitely the Kanchanara Guggulu is the primary drug. It may be even the primary cancer, even without the surgical intervention also we can use it. But as you directly pointed out, it is not going to cure the condition. It's only prevention or slowing down the spread that can be done. The only thing is that we are using this Kanchanara Guggulu in many of the benign conditions. There is a nodular appearance and nodular pathology is there, but it is a benign media. So in those conditions, definitely we can use it with a very good quantity also. If a patient could be able to tolerate, we can increase the dose for a temporarily, for a time being, maybe for 15 days to 1 month, then reduce it to the normal dosages, then observe the changes. Many times I have seen multinodular goiter and even the goiter when the thyroid gland becomes somewhat solid and hard. When I use Kanchanara Guggulu continuously along with that Amsapatyadi Kwatha, we have seen that a solid tumor like the material, the thyroid gland, it becomes soft over a period of time. So that is an indication that definitely they are acting on that. But of course, once again, it's a very, very long duration of the course of treatment. Maybe in few years it may take. So that much time of patient should be there for the patient as well as to the doctor.
Thank you, sir. And also in case, so like hypothyroidism and goiter, etc., diet and lifestyle changes play a very big role. And coming to the brands of Kanchanara Guggulu, Raghuram sir, do you have any favorite brands? Before we get his answer, this can be, there can be like personal biases, like we tend to go with like specific brands because we like them more. So this answer will be having personal bias, and it doesn't mean that some other company manufacturing this product is not great. Raghuram sir, please.
No, sir, I don't have any specific like favorite brands. So, in fact, I've seen some of my students prepare. I don't want to name in this particular context. Prepare some medicines. Some of my colleagues prepare these medicines very authentically in the Shastrokta way. So, just like as explained in the Shastra. So, with very much dedication, and I have used those medications because in the friend circle, because in the student circle, I have not promoted, I have personally used those medicines, like even Kanchanara Guggulu and Kanchanara Guggulu for the patients. They have given outstanding results. So very important is how the medicines are prepared, how authentically they are prepared, how much the ingredients and everything, and if there is a purification involved, how much that is taken care of, and how authentically that particular medicine is prepared. So it depends on that. The quality totally depends on the dedication of preparation and everything put into that particular preparation. So I don't have a specific brand which I can promote or recommend. Any good company which prepares these medicines in a good way, so are really good.
Guru sir, please.
Recently, we have launched from Pentacare a wide range of Guggulus, wherein we have taken care how to manufacture it in a very classical way. We have done the Shodhana Guggulu in such a way that, and the preparation is made, our dose of Kanchanara Guggulu or any Guggulu, almost it becomes a classical, whatever the dosage the Acharyas has mentioned, even we have reduced to 50% of that, almost. Sometimes it is 60%. So within that dosage itself, we are getting the result, as they are very much minute, because all the ingredients are passed through 120 mesh, and Guggulu is subjected for clear-cut Shodhana as explained by Acharyas. And moreover, we have done special Shodhanas with a disease-specific kashayas before manufacturing it. So if you are interested towards the Kanchanara Guggulu, then we will have an extra Shodhana with, or the fortification with Kanchanara bark kashaya, something like the Mundi kashaya, something like this is added to that. So in this way, we have done it. And particularly the Pentacare Guggulus, off late I'm using a lot of them, and I didn't get any of the side effects as such in any of the cases, not even a single one. And even of course, but even size is also very comparatively small when compared to any other brands in the market.
Sir, what is the common method of Shodhana Guggulu used by Pentacare?
So usually, generally is, one is Tifla Kashaya, then other one is we go for the hot water Shodhana first, means cleansing. Then later it is taken for Tifla Kashaya. Then we go for, even sometimes if it is required, Gomutra Shodhana, and sometimes if it is required, we will go for the fortification with the disease specific. In case of Vatari, then we'll go for an extra round of Shodhana with Yeranda Kvata. So like that, we have done all these preparations.
Thank you, sir. And there is and like whoever has a minimum setup of manufacturing facility with all the fine powders, pulverizer of good quality, etc. This is not a very hard medicine to make. Just Google Shodhana and rest of the ingredients in specified quantities in fine powder form, pound, and get it. Could not be hard. Although getting the market ready-made shape is a little bit of a challenge. Then there is a question on like what is the what are the common questions? Common side effects, or to whom in specifically this is to be avoided. That has been already answered, and that in Pitta Prakriti person, this needs to be taken with great care. And in Guggulu itself, in the Guggulu shloka itself, let me just pull that up, because it contains 50% Guggulu. In the shloka of Guggulu itself, Amlam amlam tikshnam ajirnam cha vyavayam shramam atapam madhya rosham tyaje samyak gunarthi purasya. There's some spelling mistake. I kindly excuse for that. But sour, strong, pungent, and excessive spices, vyavaya, shrama, atapa, exposure to severe sunlight, madhya, excessive alcohol, rosha, anger. Raghuram sir, all these suggest towards Pitta dosha largely, and so with Guggulu we need to be wary of Pitta dosha. Correct, sir?
Absolutely, sir. Absolutely. So they point towards Pitta and Vata disturbances and imbalances. We need to be very cautious using Guggulu. Guggulu dosage. Already Guru sir has rightly pointed out that we shall follow the classical references in terms of giving the dosages. If dose needs to be increased, definitely the Vikruti should be analyzed and the doshas involved therein should be analyzed, and we need to check how much Vata and Pitta have been disturbed in comparison to the Kapha. So that is relative imbalances of Vata, Pitta and Kapha should be seen, as already we have seen in one particular condition where Kanchanara Guggulu was given, the Vata Rakta type of symptoms have come up. So probably there was Pitta hidden behind the mask, which became very dominant in that particular scenario. So there, the Guggulu can be used, but there are different kinds of Guggulus in different Kalashrutis of different diseases. We have choices. So when we have choices, definitely we can go to the other Guggulus. And overall, seeing this is a description of the Guggulu as such. Here, definitely we need to take into consideration the Vata, Pitta, disturbing things. So like we can see Amlam, Tikshnam, Ajirnam, Vyavayam, Shramam, Atapam, Vyavaya, Shrama, again they exacerbate Vata, Madhyam, Rosham, again. So Vata Pitta is there. So wherever there the particular word Tejet has been mentioned, these particular things should be avoided. So the author is directly or indirectly hinting towards the observances of different doshas and their relative disturbances or the relative balance and imbalances. Definitely Vata and Pitta should be taken care of.
And there is a question on, does a typical tablet exceed the normal allowed dose like 1 gram, as Dr. Guraja mentioned? So to answer that, first is that, different tablets have different doses mentioned. It depends on like the kind of ingredients you are used. So based on that, some maybe say just 125 mg to some maybe Shana or 3 grams, and general dose of tablets, Vatikalpana, it is explained up to 6 grams. So this is the general consideration for most of the Ayurvedic tablets. So it depends upon the discretion of the Ayurvedic doctor while assessing the patient, the extent of disease, strength of the patient, strength of Agni, so on and so forth. Many different factors are considered. So this is like a typical tablet, that part answering. And in some cases, as in case of this Kanchanara Guggulu, one masha is specifically mentioned. For all practical purposes, it is better to stick to one masha only. Unless the doctor, unless the Ayurvedic Vaidya sees a special case, like explained by Raghuram sir and Guru sir, very rarely, after due discretion and diligence, sometimes the rule is broken. Guru sir, please.
We need to be very careful in understanding these informations, different from content of Guggulu in the tablet. See, in case of tablet weighs 250 mg, then Guggulu content in that is 125 mg. So like that, in most of the Guggulus, it is somewhere around 40 to 50% is Guggulu. So what I have suggested is a 1 gram. It is not for the Kanchanara Guggulu, but it is for the simple Guggulu. The content of Guggulu, if it is given more than 1 gram per day, then there is a chance of irritation causing a problem to the patient. So we need to calculate these things before prescribing.
Thank you, sir. And I think with respect to Kanchanara Guggulu, I think we have answered all the questions. Raghuram sir, please.
I think one more thing, sir. Many doctors don't describe the methodology in which Guggulu should be used, or with which Sahapana, Anupana, with what it should be used. Simply 1, 1, 1, 2, 2, 2. The dosage is indicated and it is given. The patient doesn't even know whether to take before food, after food, what is the tolerance, how much dosage has been given. Okay, some people Google it and some people surf and some people try to explore and some people question the doctor. how to take this, with what to take, and many people they don't take because of the rush of the OPD, especially if these things are done in the OPD scenario, and if we don't have some patient counselor outside who can explain these things to the patient. So the patient will simply take the check, go purchase the tablets, go home, sit, and there are 4 or 5 different medications. So when to take, the patient themselves will decide. I'll take these things before food, these things after food, and all those things. Probably they will search some Google and try to find out, okay, kashayam should be taken before food. Okay, I'll take before food. How much time before food? Not clear. Google how it should be taken. So these things are very important. So probably even results also are totally based on how a medicine particular, not only Google, how a particular formulation or a herb, whatever has been prescribed, it should be explained to the patient. So that is our responsibility, how it should be taken, with what it should be taken, when it should, what is the Aushadha Sevana Kala, what is the time period in which it should be taken. All these things, if they are correctly followed, the desired results will be obtained. Otherwise, leave apart. If the results are not found, it is okay. If it gives something untoward, if generally we have a taboo, like nothing can happen with these drugs or with these formulations or with these medicines. If the dosage and the method of usage has not been explained, definitely the patient will not be benefited by those things. When they come to the follow-up, they will definitely have complaints that we have taken these medicines, all these medicines, they're very genuine, they have taken all the medicines, but the results are not there. Why? Because the proper methodology of taking those medicines have not been explained to the patient. So this is very important. Before disposing of the patient from the clinic, make sure that everything has been explained by the doctor or some juniors who are counseling the patients. Everything needs to be explained, and if in doubt, please contact so and so person. There should be a person who should be solving the doubts of the patient. So if a hospital or a clinical setup has somebody who can answer those queries, doctor cannot do in the busy schedules. If somebody can do this, I think it will be definitely good. All medicines will yield very good results, especially if the diagnosis is made properly and if the medicines are explained properly, how, when, with what they should be taken.
Thank you, Raghuram sir.
I've even seen people just take Guggulus for years together. Just one time they go to the doctor, some Kanchanara or Kanchanara Guggulu has been prescribed. They just keep on popping up with, just like vitamin capsules or something, they keep on popping up with water, just water, sometimes refrigerated water, sometimes with coffee, sometimes with buttermilk. Whatever liquid is available at that particular time, they will pop up. So I don't think this does justice to those medicines or the patients.
As ironical as it might seem, I have had a patient just like 1 or 2 months had prescribed, but he took it for like 2-3 years together.
That
I
happens.
don't know, there is some affinity of patients towards Guggulu tablets. Anyway, I mean, patient education is utmost important, as you rightly pointed out. There's a question on like a Rutucharya, which we'll take up a little later. Probably this question needs a shorter answer, so I'm taking it. Raghuram sir, do we ask to discontinue if nasya burns the nasal passage? Which medicine was used for nasya is not mentioned. What can be done? What can be the reason for burning? How do we decide the right medicine in that situation? Suppose, assuming that some strong, like Tulsi Swarasa or something was used, assuming that, what is the answer?
Yeah, see, there may be different conditions in which burning sensation occurs. Generally, when we use the tailas in the form of nasya, maybe anu taila, maybe shadbindu taila, maybe ksheerabala taila, mild to moderate burning sensation and irritation will be there to the patient. Now, a new practitioner may panic. A new doctor who has never witnessed nasya are doing it for the first time all by themselves, or advising the patient to do like even a Pratimarsha nasya, which is all done by the patient themselves. They can do it. So in such conditions, there is mild to moderate burning sensation. And as you said, the dosage, if it is used in excessive atiprayoga, also it can cause some not only burning sensation, it will be associated with other conditions also, maybe like a headache, excessive secretions, sore throat, and almost some noises in the ears. Many patients have complained. So there may be many complications if things are not done in a proper way. The snehana and svedana, which are done as the prerequisites just before doing the nasya, if it is carried out in the Panchakarma clinic or the hospitals, a krama nasya which has been done. So if these things are skipped or done in excessive, or excessive svedana is given, excessive steaming is given just before the nasya, that may also already start the burning sensation inside the nostrils, and upon that the nasya is drops are dropped. Larger dosage, again, the nasya medicine which is very, very hot, so the temperature of the oil should be checked before putting it into the nostrils. A physician or an intern or somebody doing it for the first time, when the patient complains there is burning sensation, they may panic. Okay, I have selected a wrong medicine, I have done the procedure in a wrong way. No, it is, even the students should learn from the student's life itself. It is quite natural for slight to, because we are inserting some medicine which the nose has not been accustomed to. I'm speaking about nasya. It has not been accustomed. It's a foreign body. When we put there, it will tend to react. There is some reaction. So burning sensation, mild to moderate, definitely it is there in the nasya. I think so. These things should be taken care of. Where exactly it has gone wrong, whether it is for the first time done and it is a panic situation, or it is a hot oil or large quantity of the medication has been used. So what is that which is causing the burning sensation? Fine. If everything is done properly, and still if the patient is experiencing the burning sensation, everything has been methodically done, and the patient is experiencing the burning sensation, that may show that the person is having a high intolerance. It may be an individual case, the person is having high intolerance. Then slight modulations with the terms of dosage and other things can be done. Nasya done at a wrong part of a day. Nasya has been specified at particular points of day it should be done. Pratimashya can be done at different points of a day, but nasya, at which part of the day it should be done, when it should be done, even if these rules and regulations are not followed. And arha and anarha, we have conditions like who fits into the nasya therapy and who doesn't fit into the nasya therapy, indications and contraindications. If the physician doesn't know, in some contraindicated condition, if the nasya is done, so that may also pose some problem. So nasya is not a simple therapy. So because it is mentioned among the panchakarma, it should have a weightage. 1/5 of the 5 important tools of Ayurveda, it should be done. After doing everything properly, if still the patient is having some intolerance, then the medicine shall be discontinued, and then the doctor can attempt with the same medication or a changed medication if there is an alternate source for that. As you already said, as Hebarsa rightly pointed out, Tikshna Dravyas, maybe with the Shunti, that is a ginger, or with Tulsi, Osimum Sanctum, with these things are Tikshna Dravyas. They're very sharp in nature. When nasya is done with those swarasas also, it is highly intolerable. Many people don't tolerate when nasya is done with powders, especially. And with juices, fresh extracted juices, there are various forms. Dhuma nasya, if it is given in the form of smoke, it can cause dryness and burning sensation. Which form of nasya we are using, that is also important. So seeing all these things, if still the person is having a problem, so then it's not the methodology, it's not the physician, it's not the dose, it's not the pattern, then the medicine needs to be discontinued for some time. Try with some other medications, try with some other medicine at some other point of time. The Rutu, again, the season is also, season in which we are doing the nasya is also very, very important. In a cold season, in a cloudy season, if the nasya is done, so it can cause some complications like a stuffy nose. Some people may experience with post-nasal drip and also burning sensation and all those things. So, and the last one is the paschat karma. After doing the nasya, there are some indications which we should tell the patient to go home, or if it is in a clinical setup, we will ask them to do, like maybe a warm water gargle or something, and at what time the food should be taken. The person should not be exposed to the cold things and other things after doing an assay. There are so many restrictions and contraindications and indications in paschat karma, that is in the follow-up. It is not the follow-up after the therapy, it is a daily follow-up after every day nasya. If those things are not followed also, it is it can lead to various symptoms like burning sensation. So many things need to be taken care of while doing these therapies. And it should be the physician who should judge why the patient is complaining the burning sensation. As I said, the golden rule is, if after doing everything in a correct way, if the patient is still having the burning sensation, stop that therapy and try with a different medication after some days. And if it is not mandatory, go with some alternate therapy. The person's nose is hypersensitive to medicines, any type of medicines. If you use Anutaila, it is giving some burning sensation and other reactions. After some time, you give a gap of 15 days and start with Shadbindu. Again, give a gap and start with Chirabala Taila. Whatever you are using, the person is having the burning sensation. It is not anything but the nose which is in trouble. There is hypersensitivity. There are many people whose nasal cavity is very, very, very sensitive to certain medications. They cannot tolerate any form of medication. Plan B should be taken for those people.
Thank you, sir. Guru sir, as explained very well by Raghuram sir, considering that it is a serious business, nasya is, if someone is getting burning sensation, what could be the remedial measures? Please?
See, whenever there is a burning sensation, if a patient really concerned and is the way he is expressing, I'm getting severe burning sensation, then the process has to be halted even in the earlier stage. If it's already done, then there is a problem. Then we need to go for something which is soothing in nature. Like it may go for something like that, which can be beneficial. For example, warm, room temperature level, something like Kshirabala Taila, it can also be added. If a person has developed irritation because of Kshirabala Taila only, then you need to stop the process or the procedure and wait for a certain time to get the things done out. And if it is possible, whatever it comes to the mouth isn't, you can sneeze it out and take it off. That can be, you can avoid it. But still, using a ghee is also one of the option. Even sometimes, even a little bit of what you call coconut oil. Plain coconut oil can also be soothing in nature. That can also be used. So all these things are the possibilities. But we need to understand what particular type of oil has given an irritation. Whether the irritation was to the standard level or it is more than that. That needs to be understood before going for any interventions.
Thank you, sir. And that brings us to the end of this session. Thank you for all the wonderful questions. And on behalf of us, all of us students, my words of gratitude to Raghuram sir and Guru sir. Thank you, sir. Thank you all. Namaste.